Hello everyone, very good morning. This is Dr.Krishna here. I'm a urologist, andrologist, and I take care of women's sexual well-being. And my clinic is located near Radhika Theatre, X Road, AS Rao Nagar, Hyderabad. So, today I would like to discuss about urinary tract infections. Urinary tract infections are very common, and especially when it comes to males and females. Let me discuss a bit about females first. Female urethra is only 4 centimeters in length with a functional 3 centimeter urethra. So usually because of a regular sexual activity or because of hormonal imbalances, usually females have a recurrent urinary tract infection apart from having hypertension or diabetes or other infections of any sort. So urinary tract infection needs to be appropriately treated in females. If it is an uncomplicated UTI, you can give a 3 days of simple fluoroquinolone drugs. And if it is complicated UTI, well, we will discuss what is complicated UTI too. You better have a culture getting done, and apart from that culture, we can have baseline antibiotics started, and when the culture comes, we can change it to appropriate antibiotic, and this is the best way to treat a female. But when it comes to male, usually they are complicated UTIs because of the long length of the urethra. Apart from that, we also have, it can be said that the organism can be resistant, and complicated UTIs are usually conquered or they usually occur in a male. So it is better and it is always accurate to obtain a urine culture. And when it comes to UTI, usually when the organisms are grown in a culture, if it is more than 10 to the power of 5 organisms per high power field, it is considered significant. But when the patient has symptomatic LUTS, we consider even more than 10 to the power of 2 organisms or is also very significant, and we better treat the person. And so apart from starting the symptomatic antibiotics, we also go for higher antibiotics if necessary as per the culture. And we better evaluate the UTI because we have to see the upper tract, lower tract. We see the ultrasound for bladder wall thickness, renal parenchymal thickness, and any calculus disease if any obstructive things if any. So these are the baseline evaluations for urinary tract infections. Now when we come about or talk about recurrent urinary tract infections, the definition is as simple as that: occurrence of 2 times in 6 months or more than 3 times in a year is called UTI. And I am very skeptical about the word when someone says urinary tract infection unless there is no proven culture growth. So I would advise everyone to have a culture getting done when it comes to dysuria and burning and symptomatic LUTS. So I would advise everyone to meet a urologist as soon as possible and do not have treatment getting with the improper antibiotics or improper level of treatment, and let protocol be a protocol. And everyone, I hope everyone will have a wonderful day. Thank you, and stay well and stay safe in Corona. Thank you. Thanks everyone. Thanks for the patient listening.